1. The role of X-ray detectable grid. Computed tomography, CT, digital radiography, DR. It has been increasingly used in the diagnosis of related diseases. However, lesion localization remains a challenge. Doctors can roughly observe the size and shape of the patient's lesion by analyzing the 2D slice images of the CT or DR sequences of the patient's organs. When doctors obtain multiple sequence images of a patient for a certain image, the doctor does not know the exact position of the slice image on the tissue organ. The X-ray detectable grid developed, produced, and sold by Nanjing Forest Industry, combining with the human body through imaging, helps doctors find the spatial corresponding position between determine the best position for lesion puncture or incision. 2. Usage of X-ray detectable grid. 1. Routine disinfecting using CT positioning lines. 2. After the disinfectant has dried, apply the X-ray detectable grid. 3. Scan after application of the positioning patch in CT. The scanning range should include the upper and lower levels of the lesion. At this time, the marked imaging strip can be seen, displayed on the CT image as high-density shadows spaced at intervals of 1 cm. 4. Measure the distance from the puncture point to the pleura. That is the distance to the lesion. Perform CT scanning and reconstruct the surrounding left and right levels. Combine with the positioning patch in CT images. Choose a suitable puncture point on the body surface. Mark it with a skin marker pen. 6. Local infiltration anesthesia with 2% lidocaine to treat the pleura. Select a suitable biopsy needle. Puncture according to the positioning angle and depth. When the tip of the biopsy needle is located inside the edge of the lesion, biopsy can be performed. 7. After the puncture is completed, apply pressure to the puncture site to stop bleeding. 3. Clinical application scope of Nanjing Forest Industry X-ray detectable grid. 1. Biopsy. 2. Anesthesia. 3. Surgical positioning. 4. Nanjing Sengong X-ray detectable grid. 1. Reduce medical cross-infection. Reduce patient pain and costs. Reduce the size of surgical incisions and greatly improve the accuracy of surgery. Reduce unnecessary punctures. Reduce unnecessary surgical errors. 2. Improve doctors' technical specifications for standardized surgical procedures. Standardize surgical puncture or tissue localization. Reduce surgical risks. Also beneficial for improving doctors' skills. Help doctors reduce judgment errors. Usually, surgeons need to perform 200 to 300 surgeries to achieve proficiency, but with the use of medical image-based external positioning adhesive, the same level of proficiency can be reached after 8 to 9 surgeries. By using medical image-based external positioning adhesive, inexperienced young doctors can quickly grow. 3. Enhance the overall efficiency of hospitals. Compared to traditional metal localization, robotic surgical localization, Nanjing Sengong medical image-based external positioning adhesive has out in improving the overall efficiency of hospitals.